Look, if you agree with Bobby Kennedy that America is not very healthy right now, that 40% of Americans have a chronic disease, our children, 20% of them are on some type of prescription drug, there's a mental health explosion in our young children. So I think Bobby just needs to share his heart. He needs to share with America why this is so important to him and really disarm some of the false issues out there like you mentioned. He's not anti-vax. He's pro letting parents understand exactly what's in those vaccines, letting that decision between the doctor and the patient to preserve that very precious relationship.
Before he left town, Mayorkas signed an order that said for 18 months they were going to extend this protection to people that are in temporary protected status, which meant they were going to be able to stay here and violate our laws for another 18 months, and we stopped that. Today we signed an executive order within the Department of Homeland Security in a direction that we were not going to follow through on what he did to tie our hands, that we are going to follow the process, evaluate all of these individuals that are in our country, including the Venezuelans that are here and members of TDA. Listen, I was in New York City yesterday, and the people of this country want these dirtbags out. They want their communities to be safe. It was so amazing to me to see people walk by us on the street early in the morning and just say, thank you. Thank you for being here. So this is part of our plan to make sure that we're protecting America, keeping it safe again, just like President Trump promised.
President Trump has used every lever of his executive power to ensure that we can secure the border and launch this large mass deportation operation. And I would echo the comments of my colleague, Mr. Homan. While this has been a great start, we will not get complacent. The previous administration allowed tens of millions of illegal people into the interior of our country. And President Trump has promised the American people that he is going to deport those individuals. And so every single day, this administration is empowering law enforcement agents on the ground across our country to do their jobs, to work with federal law enforcement officers in CBP and in ICE to deport heinous illegal criminals from American communities. We also will need more funding from Congress when it comes to detention and deportation efforts. And that's something President Trump has made very clear to our allies on Capitol Hill as well.
Throughout this process, Mr. Kennedy, you have been accessible to members and staff on both sides of the aisle and have demonstrated strong commitment to fulfilling the responsibilities of this role. Share with the committee why you are passionate about the nutrition-oriented disease prevention and what you have learned.
Yes, Mr. Chairman. I had 11 brothers and sisters. I had dozens of first cousins. I was raised in a time where we did not have a chronic disease epidemic. When my uncle was president, 2% of American kids had chronic disease. Today, 66% have chronic disease. We spend zero on chronic disease during the Kennedy administration. Today, we spend $4.3 trillion a year. With 77% of our kids cannot qualify for military service. When I was a kid, the typical pediatrician would see one case of diabetes in his or her lifetime, 40 or 50-year career. Today, 1 out of every 3 kids who walks through his or her office door is diabetic or pre-diabetic. And the most recent data from NIH shows 38% of teens are diabetic or pre-diabetic. Autism rates have gone from 1 in 10,000 to 1 in 1,500, depending on what studies you look at. In my generation today, 70-year-old men, 1 in 34 in my kids' generation. We've seen this explosion of autoimmune disease, of allergic diseases. This is not just a economic issue. It's not just a national security issue. It is a spiritual issue, and it is a moral issue. We cannot live up to our role as an exemplary nation, as a moral authority around the world, and we're writing off an entire generation of kids.
You know, one of my mentors in business always said that any good business has both product people and sales people. And Howard is one of the few people who is both a product guy and a sales guy. And I want to talk about that because I think that America, as Commerce Secretary, needs a Commerce Secretary who is both a product guy and a sales guy. And what do I mean by that? Well, if you look at his career, Howard is the kind of guy who developed innovative products. He has a number of patents to his name, something I didn't even know when I first got to know Howard, but I learned later. But he's also an incredible sales guy. This is a person who, on the world stage, will say more and do more and convince businesses that America is back, that America is growing and thriving. And I think that will inure to the benefit, most importantly, of American workers who have seen their wages stagnate, their real living standards decline. And Howard is exactly the kind of guy that we need to reverse that trend and get American commerce back on track.
Podcast in 2020, you said, and I quote, you would do anything, pay anything to go back in time and not vaccinate your kids. Mr. Kennedy, all of these things cannot be true. So, are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast and will see this, he asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective, and I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right. So
he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden, so bringing this up right now is dishonest. Chairman Crapo, Ranking Member Wyden, and members of this distinguished committee, I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I also want to thank Cheryl and Kik and Bobby and all of my other children who are here today, and all the many members of my large extended family for the love that they have so generously shared. Ours has always been a family that has been involved in public service, and I look forward to continuing that tradition. My journey into the issue of health began with my career as an environmental attorney, working with hunters and fishermen and mothers in the small town in the Hudson Valley and along the Hudson River. I learned very early on that human health and environmental injuries are intertwined. The same chemicals that kill fish make people sick also. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponentially. The United States has worse health than any other developed nation, yet we spend more on health care, at least double, and in some cases triple, as other countries. Last year, we spent $4.8 trillion, not counting the indirect costs of missed work. That's almost a fifth of GDP. It's tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for health and have better outcomes and a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to restore America's global strength and to restore the American dream, but he understands we can't be a strong nation when our people are so sick. A healthy person has 1,000 dreams. A sick person has only one. Today, over half of our countrymen and women are chronically ill. When I met with President Trump last summer, I discovered that he is more than just concerned for this tragic situation, but genuine care. President Trump is committed to restoring the American dream, and 77 million Americans delivered a mandate to him to do just that, due in part to the embrace and elevation of the Make America Healthy Again movement. This movement, led largely by Maha moms from every state, and you can see many of them behind us today, and in the hallways and in the lobbies, is one of the most transcendent and powerful movements I've ever seen. I promised President Trump that if confirmed, I will do everything in my power to put the health of Americans back on track. And I've been greatly heartened to discover a deep level of care among members of this committee, too, both Democrats and Republicans. I came away from our conversations confident that we can put aside our divisions for the sake of a healthier America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20%, there are no good options, only bad ones. Shifting the burden around between government and corporations and insurers and providers and families is like rearranging deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change the course and ask, why are healthcare costs so high in the first place? The obvious answer is chronic disease. The CDC says 90% of healthcare spending goes toward managing chronic disease, which hits lower-income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all of our people healthy again. There is no single culprit in chronic disease. Much as I have criticized certain industries and agencies, President Trump and I understand that most of their scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal. Before I conclude, I want to make sure the committee is clear about a few things. News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety.
We'll have order. Please proceed, Mr. Kennedy.
I am pro-safety. I worked for years to raise awareness about the mercury and toxic chemicals in fish, and nobody called me anti-fish. And I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. My first book in 2014, the first line of it is, I am not anti-vaccine, and the last line is, I am not anti-vaccine. Nor am I the enemy of food producers. American farms are the bedrock of our culture, of our politics, of our national security. I was a 4-H kid, and I spent my summer working on ranches. I went to work with our farmers. I want to work with our farmers and food producers to remove burdensome regulations and unleash American ingenuity. MAHA simply cannot succeed without a partnership, a full partnership of American farmers. In my advocacy, I've often disturbed the status quo by asking uncomfortable questions. Well, I'm not going to apologize for that. We have massive health problems in this country that we must face honestly. And the first thing I've done every morning for the past 20 years is to get on my knees and pray to God that he would put me in a position to end the chronic disease epidemic and to help America's children. That's why I'm so grateful to President Trump for the opportunity to sit before you today and seek your support and partnership in this endeavor. I will conclude with a promise. The members of this committee, to the president, and to all the tens of millions of parents across America, especially the moms, who have propelled this issue to center stage. Should I be so privileged as to be confirmed, we will make sure our tax dollars support healthy foods. We will scrutinize the chemical additives in our food supply. We will remove financial conflicts of interest from our agencies. We will create an honest, unbiased gold standard science at HHS, accountable to the President, to Congress, and to the American people. We will reverse the chronic disease epidemic and put the nation back on the road to good health. Thank you.
So my plan is to only serve the American people. So I will divest, meaning I will sell all of my interests, all of my business interests, all of my assets, everything. I've worked together with the Office of Government Ethics, and we've reached agreement on how to do that, and I will be divesting within 90 days upon my confirmation. So I should have no business interest, therefore no conflicts of interest. I've made the decision that I've made enough money in my life. I can take care of myself. I can take care of my family. It is now my chance to serve the American people. And so upon confirmation, my businesses will be for sale, and someone else will lead them going forward. But the Office of Government Ethics and I have reached agreement. We've signed the document. I've made it public. And going forward, I will always consult. The Commerce Department has a great ethics department. I've already met with them, and I plan to stay in close contact with them and avoid all conflicts so I can just serve.
My approach to administration HHS will be radical transparency. If members of this committee or other members of Congress want information, the doors are open. I've spent many years litigating against NIH and its sub-agencies, HHS and its sub-agencies, NIH, CDC, FDA, on FOIA issues, trying to get information that we, the taxpayers, paid for, and oftentimes getting back redacted copies after a year or 2 years of litigation. That should not be the case. And if Congress asks me for information, you will get it immediately. To figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing that. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough?
The Department of Commerce has led the world in cyber, right? Our cyber technology and cyber rules are the gold standard of the world. Let's leverage that model into the standards for artificial intelligence. Let's use what we're great at and leverage that again and use it again. So rather than think about it, we want to make sure we protect and defend our country, but we want to make sure that we lead. It has to be an American-driven leadership in AI. It is fundamental. So leverage what we're great at and issue standards and practices like we did in cyber that will encourage private sector to be the dominant winner. As we are in America, we've got to do that and make sure we win.
I was a school superintendent before I was in this job, Mr. Chairman, and I can tell you that Mr. Kennedy's right, that when I look at the kids in the Denver public schools, if we don't change the way we eat in this country, 40% of them are going to suffer adult diabetes as a result of their
I will commit to not firing anybody who's doing their job.
I think when you pick one product in Mexico, they'll pick one product. We pick avocados, they pick white corn, we pick tomatoes, they pick yellow corn. All you're doing is picking on farmers, which is just not going to happen. My way of thinking, and I discussed this with the president, is country by country, macro. Let America make it more fair. We are treated horribly by the global trading environment. They all have higher tariffs, non-tariff trade barriers, and subsidies. They treat us poorly. We need to be treated better. We need to be treated with respect, and we can use tariffs to create reciprocity, fairness, and respect.
Mr. Kennedy, I'm glad to see you here this morning. I listened to your opening remarks, and you mentioned that you want to make HHS the gold standard of science. I have found my engagements with you, both behind closed doors in my office, as well as listen to you publicly, to be very thoughtful and science-based. I applaud that. I thank you for that. And I realize this will likely be a very partisan vote on this committee and on the Senate floor. But let the record state there are 3 medical doctors on this side of the dais. I'm a chemical engineer. We believe in science. I'm thankful that you do too, and you made that comment in your opening remarks. My question for you, Mr. Kennedy, is if confirmed, as I'm listening to my farmers and ranchers talk about the future, will you commit to working collaboratively with partners at USDA, at the relevant federal agencies, as well as our Montana farmers and ranchers, before implementing any policy that might affect or impact food supply?
Absolutely will make that commitment. I have, as I shared with you, a personal commitment and a long career working with farmers. I want to make sure I understand the very, very narrow margins, the slim margins that American farmers and ranchers are dealing with. And I don't want, under my watch, a single farmer to have to leave his farm for economic reasons or for regulatory or bureaucratic reasons while I serve, if I'm privileged to serve, to be confirmed as HHS Secretary. Even more important, President Trump has a very, very strong commitment to farmers. President Trump is probably historically, in modern history, the best farm president in our history. Farm income spiked for the first time in decades under his last administration. He got solid support from farmers across the country. Farm country is Trump country. Farmers across the country supported him during this election. He has specifically instructed me that he wants farmers involved in every policy, and that he wants me to work with Brooke Rollins at USDA to make sure that we preserve American farmers, that all of our policies support them.
Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh. Yeah, I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with.
Approach HHS, as I said before, Senator, is radical transparency. Democrats and Republicans ought to be able to come in and get information that was generated at taxpayer expense, that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency.
The tariff view is going to be studied, and the president launched that in an executive order where he asked the Commerce Department and the USTR to study the tariff model long term. The short term issue is illegal migration and, worse even still, fentanyl coming into this country and killing over 100,000 Americans. There's no war we could have that would kill 100,000 Americans. The president is focused on ending fentanyl coming into the country. You know that the labs in Canada are run by Mexican cartels. So this tariff model is simply to shut their borders with respect America. If we are your biggest trading partner, show us the respect, shut your border, and end fentanyl coming into this country. So it is not a tariff per se. It is an action of domestic policy. Shut your border and stop allowing fentanyl into our country, killing our people. So this is a separate tariff to create action from Mexico and action from Canada. And as far as I know, they are acting swiftly. And if they execute it, there will be no tariff. And if they don't, then there will be. But it's an action-oriented model. That's not the ordinary tariff. The ordinary tariffs need to be studied and examined, and that will start, as the EO said, in April.
So that's a separate tariff.
Correct.
After that study, what would be the timeline of that?
I think that's sort of in April. Those studies will come out in the end of March and April, and then you'll hear about those at that time. So big macro issues with tariff are being studied, but the micro issue is Canada and Mexico and the precursors from China. They need to end, and we need to protect our Americans from fentanyl. And our trading partners in Canada and Mexico, they should end it and stop disrespecting us and allowing this to come through our borders.
Well, I think we all agree on secure borders. I'm with you all the way. Being a northern border state, the ranking member on Homeland Security.
I was told that I was a conspiracy theorist. That label was applied to me because I said that the vaccines, the COVID vaccine, didn't prevent transmission and it wouldn't prevent infection, when the government was telling people, Americans, that it would. I was saying that because I was looking at the monkey studies in May of 2020. I was called a conspiracy. Now everybody admits it. I was called a conspiracy theorist because I said red dye caused cancer. And now FDA has acknowledged that and banned it. I was called a conspiracy theorist because I said fluoride lowered IQ. Last week, JAMA published a meta-review of 87 studies saying that there's a direct inverse correlation between IQ loss.
All right, so I'm going to assume
I could go on for about a week.
Is there any one of them that you can say, you got me, that really was a conspiracy theory, or are you in a position to submit for the record? I think it'd just be helpful for every one of these narratives for you to submit that maybe for the record.
What I want to do is, I'm not a scientist. I want to empower scientists. I want to make sure that science is unobstructed by vested or economic interest. I believe that Medicaid is a critical program, but that it's not working as well as it ought to be. And President Trump has asked me to make it work better, that most Americans are not happy with it, that the premiums are too high, the deductibles are too high, and everybody's getting sicker. Too much money is going to the insurance industry.
Trinity, I believe for such a time as this that you're not just one of 300 million people. I think that you are the person to lead HHS to make America healthy again, that God has a divine purpose for you, and I look forward to your confirmation and working with you to make America healthy again.
Thank you, Senator.
Thank you.
President Trump has asked me to end the chronic disease epidemic and make America healthy again. And
so is that the only reason why you're at HHS? Is that the only reason why then you're at the HHS, to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically, to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
More money is being wasted, and the Department of Government Efficiency is going to fix that. We're going to get the government off your back and out of your pocketbook.
UK government, if it really wants to restore competitiveness, if it really wants to deliver growth, simple, abolish APD. I wrote a letter to the Rachel Reeves on the 2nd of December, calling on her, if she was serious about delivering growth, abolish APD. I get a letter back this week from some dopey junior minister, James Murray, who's the Exchequer Secretary to the Treasury. He helpfully told me that actually the rate of APD increase is only going up by £2 for those flying short-haul economy. That is 1% of an average airfare. £2 is 1% of an average short-haul economy low fare. I don't know what fucking airline this dopey git actually flies on that has economy airfares of £200. But the £2 is not 1% of an average airfare. But it probably shows you just how out of touch Her Majesty's Treasury are with fucking reality. The average fare, economy fare on, we only have economy, the average fare on Ryanair last year in the UK was £44 sterling. APD is currently £13 going to £15, and that is a penal rate of tax and something that should be abolished straight away. If Rachel Rubbish is serious about delivering growth, abolish aviation tax. We don't mind if she comes up with the third runway in Heathrow, although please understand it won't be delivered until 2040 or 2050 at the earliest. But at least while you're waiting for that dead cow to breathe life into that dead cat, can you please abolish APD and then allow us to get on with delivering real growth? We promised her in writing that actually if she abolishes APD, Ryanair would take its traffic from 60 million passengers in the UK to 90 million within 4 years. 50% growth. And that growth would be spread across airports across the UK.